We've been in conversation with Professor Amit Gefen, a former president of the European Pressure Ulcer Advisory Panel and Professor of Biomedical Engineering at Tel Aviv University. Professor Gefen shares with us some of the latest research he's carried out into the underlying causes of pressure ulcers, and in particular the role, as we now understand it, of friction and the associated shearing.
When our body is weight-bearing, cells are distorted and deformed. As cells are distorted and deformed, they change their function. They actually lose functionality and lose viability over time. What we would like to do is to minimize the exposure of cells and tissues to sustained distortion and deformations.
So why is deformation caused by compression and shearing so harmful?
Deformation is a cell killer. If we minimize the exposure of cells and tissues to deformations, to sustain deformations, we provide protection.
So how are patients exposed to cell deformation in real-life situations?
When someone is lying in bed, tending to slide down in the bed as a result, for example, of someone elevating the head of the bed, and when gravity pulls the body down and the person is sliding, the heels are trying to keep contact with the bed but are dragged down the bed as gravity acts. The forces, which are in fact the frictional forces that distort the tissues as this process takes place, are damaging the cells, are compromising their viability. And so if we minimize those forces, if we control them, if we mitigate these effects of friction, we protect the tissues of the heel.
Could you explain that to us in a little bit more detail, please?
What I'd like to do is to protect the heel. If we look at the structure of the heel, so this is the foot, and we focus on the heel. And the heel is resting against a support surface. So this is the support surface. And now the person is sliding in his bed. And so frictional forces are developed here and are distorting the tissues just here, not only on the skin surface, but also internally. We reduce these frictional forces. We reduce them to the extent where that cell distortion here would be minimal. And you can do that by controlling the level of friction and reducing the level of friction at the support body interface.
We asked Professor Gefen if he could demonstrate how his advanced computer modelling techniques can be used to show how low friction fabrics can reduce internal cell deformation in the heel area, for example. By making use of sophisticated computer modelling techniques, Professor Gefen explains how 2 layers of low friction fabric sliding over one another can help alleviate deep tissue strains in the heel area. How then could a low friction fabric garment, such as a low friction fabric bootie, actually help to prevent pressure ulcer formation on the heel?
One good example for such a friction reducing material is the Parafricta booties, which are designed to lower the friction at around the heel, at the posterior heel region, when body weight and frictional forces apply. As opposed to normal cotton, the specific design of these fabrics facilitates a very smooth texture of actually 2 layers of fabric that are sliding against each other, hence absorbing these frictional forces that are transferred between the body and the support surface.
Well, thank you for your time today, Professor Gefen. I'm going to try and summarize what I think you've told us if I can. Um, so, sustained body-wide deformation causes cell and tissue damage. That happens very rapidly. Friction is a big contributor to that deformation damage, both at the surface and deep tissue. Heels are very vulnerable, but you can help to mitigate all of these damaging effects with the use of a low friction fabric such as Parafricta in a Parafricta bootie. Thank you.